Hello, I'm Sven Gudmund Hinderaker at Center for International Health, University of Bergen. In this lecture, I will tell you about how to study the risks of tuberculosis in epidemiological terms. The objectives of the lecture are to explain the epidemiological transitions in tuberculosis. We need to understand and identify outcome measurements to use in epidemiological studies and assess determinants or risk factors for each step. Studying risk of tuberculosis can be complicated, and in order to assess these risk factors, we need to study the process in epidemiological steps, as each step may have different risk factors. Look at this. First, a person must be exposed to Mycobacterium tuberculosis. Once exposed, you can be infected or not. Once infected, you may develop tuberculosis disease or not. Once you have the disease, you may die or survive. Let us first take a look at exposure. What are the risk factors for being exposed to Mycobacterium tuberculosis? The outcome measurement in this situation is the number of persons exposed to the bacteria. The tuberculosis bacteria in the lungs will produce expectorate that the patient will cough up. This sputum will often contain bacteria. Some of the small droplets with bacteria will float in the air and may be inhaled by any person exposed to this air. Exposure is difficult to measure and therefore not commonly used, but it is possible by air sampling with quantitative PCR examination. A well-known determinant for exposure to Mycobacterium tuberculosis is the number of infectious cases in the surroundings, for example measured as the incidence of smear-positive tuberculosis. The higher the incidence in the population, the more persons will be exposed. Another determinant is the duration of disease in the patients suffering from tuberculosis. Sick persons who live long and remains contagious contribute more to exposure to Mycobacterium tuberculosis than patients who are early detected and treated, or those who die early. Another determinant is the number of times susceptible persons are in close contact with the source and breathing the same air, and hence sharing room with a coughing tuberculosis patient is a definite risk factor. Once you're exposed to tuberculosis bacteria, what are the determinants of infection with tuberculosis? The outcome measurement here is infection by Mycobacterium tuberculosis.
Let me first explain to you what infection is. It is not necessarily a situation with disease. We often use the word in that sense. Here, infection means colonization by bacteria in the body tissues, and may be without any clinical signs or subclinical. Colonization usually leads to some degree of inflammation, where the immune system deals with the invading organism, destroying living bacteria. In this environment, some bacteria may enter a latent phase and will survive as sleeping bacteria inside the body cells. Inflammation will be almost absent in HIV-positive patients, where the immune system does not work properly. Infection by Mycobacterium tuberculosis can be measured by tuberculin skin test, abbreviated TST, or by interferon gamma release assay, abbreviated IGRA. The MAN2 test is a TST. It is done by injecting tuberculin into the skin of the patient. This tuberculin is extracted from tuberculosis bacteria. An immune response in the skin shows that the body recognizes parts of Mycobacteria non-specifically. IGRA tests are taken with blood samples. Exposing this blood to specific parts of the tuberculosis bacteria in vitro can show that the patient has been infected before by Mycobacterium tuberculosis and recognizes it. It is specific on pathogenic mycobacteria. But none of these tests gives evidence that the bacteria themselves exist in the body when the test is taken. Vicinity to an infectious patient with tuberculosis is a risk factor, and crowding will expose many persons if there is a contagious person in the area. Risk factors for infection that are easy to measure are therefore incidence or notification of smear-positive patients. The bacterial load of the source case is also a determinant, for example, as indicated by grade of positivity in a microscope. It is also dependent on duration of the exposure to the source case, like time shared in the same room. What are the risk factors for developing tuberculosis disease, whether infectious or not, once you're infected? The outcome measurement is incidence of tuberculosis disease. The risk of developing disease once you're infected is much higher the first years after the initial infection. Then after some years, the risk wanes. Some well-known risk factors for developing disease are shown in this figure. The risk is compared to the risk of an old latent infection, which is set at 1. The strongest risk factor by far is HIV disease, which untreated may have 100 times higher risk. Compared to an old latent infection, a big infection dose may have double risk. Diabetes mellitus has 5 times higher risk. Underweight 4 times higher risk. Heavy smoking double risk. And recent infection 20 times higher risk. This map shows estimated incidence rates of tuberculosis, which means new cases in a year per 100,000 population. The darker colors have higher incidence rates of tuberculosis. Africa south of Sahara and Southeast Asia have higher rates. What are the risk factors for dying or surviving from tuberculosis? In such a study, the outcome measurement is death. Deaths in general will depend on many factors and overriding determinants like baseline mortality in the area, age-specific mortality rates, and external catastrophic events. The risk of dying from tuberculosis depends on many factors. Obvious determinants to investigate would be anatomical site, bacterial load, advanced disease, HIV, treatment, health system, and patient characteristics. This map shows the estimated tuberculosis mortality rates by country. Again, this is not in absolute numbers, but rates. Not surprisingly, you notice that mortality rates are higher in Africa and Southern Asia, either with a significant HIV co-epidemic or poverty, and often both. In conclusion, when you study tuberculosis and its risk factors, make sure you study the correct transitions using correct outcome measurement before you identify the risk factors.